Today is Saturday, May 2nd, and the coronavirus numbers are in, updated as of April 30th. For weeks, we couldn't get enough coronavirus test kits to test everyone who even wanted one, unless of course you were an athlete, somebody famous, or maybe a tiger at the New York Zoo. So let's take a look at what a regular flu season might look like versus COVID. We're going to share the symptoms, the data, and everything that's going on. Now, all the information I have here is provided through the CDC. You can see in 2017, we had 48.8 million people get sick. There were 959,000 hospitalizations, 79,400 deaths in a regular flu season. Now, how does that compare to COVID? 1,092,815 cases and 64,000 deaths. But are the numbers comparable, and are they adding up? As of April 14th, which is just 2 weeks ago, CDC case counts and death counts include both confirmed and probable cases and deaths. If at any point you may have shown symptoms of COVID-19, whether you were tested or not, you may be listed as a COVID-19 death.
There are other countries that if you had a pre-existing condition, and let's say the virus caused you to go to the ICU and then have a heart or kidney problem, some countries are recording that as a heart issue or a kidney issue and not a COVID-19 death. Right now, we're still recording it, and the great thing about having forms that come in and a form that has the ability to mark it as COVID-19 infection, the intent is right now that if someone dies with COVID-19, we are counting that as a COVID-19 death.
Can you be sure? I mean, you hear from coroners that that's not necessarily the case. Or are you sure? How can you be confident about that? And is there any concern that it skews?
Even the coronavirus task force is telling you that they're inflating these death numbers. Here's the CDC data on the U.S. outpatient influenza-like illness. Take a look at this entire section here. So this is reported by the year 2019, and then it's the week of the year. So the 40th week of the year is about October. So look at how many total flu-like illnesses and total patient visits we had throughout October, November, December, and January. And then it starts to taper off in March. And as you see, we have the lowest amount of total patient visits and total flu-like illnesses right now, as of today. We have less people in the hospital now than in January, before this was a pandemic. Now, a typical flu season goes from about October until March, sometimes as late as May. So we should expect the same for the coronavirus. Every year, based on the previous flu season, the CDC estimates on what they expect the next season to look like. They expected 39 million to 56 million flu illnesses, 18 million to 26 million flu medical visits. They anticipated 410,000 to 740,000 hospitalizations, and they already anticipated 24,000 to 62,000 flu deaths. Now, it's important to note, the week of April 4th was the last week in-season influenza burden estimates will be provided. If we take a look at the regular flu symptoms, in adults, it's difficulty breathing or shortness of breath, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, inability to arouse. Seizures, not urinating, severe muscle pain, severe weakness or unsteadiness, fever or cough. In children, you can expect to see fast breathing or trouble breathing, bluish lips or face, chest pain, severe muscle pain, dehydration, not alert or interacting when awake, seizures, fever above 104. Take a look at all of these symptoms. Doesn't this sound exactly like COVID-19, at least on the severe side? And if these numbers are accurate, they seem to be in line with the regular flu season.
So I think in this country, we've taken a very liberal approach to mortality. The intent is right now that if someone dies with COVID-19, we are counting that. If someone dies with COVID-19, we are counting that. We are counting that.
If you found this information helpful or useful, please like, comment, share, and subscribe to our channel.